So we know that congestive heart failure is a condition where your heart does not work properly. And sometimes that's frightening, right? Knowing that your heart's not working properly. But as with all other conditions with congestive heart failure, with proper medication and proper observation and treatment, that you can live an almost normal life. You just have to watch your diet, take all your medications, and follow all instructions from your nurse and from your doctor. So with congestive heart failure, we all know that the heart does not pump enough blood to all the organs and tissues of the body. And what happens is, because the organs are not getting enough blood, you have some edema. Fluid accumulates in your lungs. Mostly you can see it in your feet, your legs. Sometimes you have fluid accumulation in your abdomen. Okay? So for those of you who may or may not have noticed, this is not fluid accumulation. I actually have a little, I think, bambina in here. So, okay, so there you go. What causes heart failure? So there's a lot of things that causes heart failure. Why does your heart suddenly is not pumping enough blood? There's what we call coronary heart disease. This just means that the arteries supplying your heart are narrowed, or there's blockage, and therefore you have decreased blood going to your heart. Your heart is just like any other organ. It not only pumps blood, but it actually receives blood like the rest of your organs. There's arteries and veins going into the heart, supplying the muscles of the heart. So when that blood flow is decreased by coronary heart disease, then you may develop congestive heart failure. When you have a heart attack, or they call an MI, when you have a heart attack, what happens is not only are your arteries narrowed, they actually shut down. It's completely occluded. And so, that artery that's supplying a specific part of your heart, there's suddenly no blood flowing to that part of your heart. The muscle of your heart that's supplied by that artery dies. So that's why a heart attack could cause congestive heart failure. Yes, sir.
Supplied by the heart artery or the vein coming back? The artery going throw away.
Yes, but that's with the heart pumping the blood. The heart receives inside its chambers, which we call the ventricles. It receives blood to pump back out. So that's the only place in the body where it's reversed. It receives from the vein, and then it pumps out through the artery. But the heart itself, so it's pumping like this, but the heart itself, it just doesn't receive blood. It also it doesn't just receive blood to pump out, but it also has arteries supplying the actual heart muscle. Yes. So another thing that causes heart failure, cardiomyopathy. This means the muscles of your heart are weak. Now, usually this term is used to describe damage to the heart muscle that's not from the blood vessel. Usually this is from infections, alcohol, drug abuse. These all could lead to cardiomyopathy. Conditions that overwork the heart can cause heart failure. So what makes your heart work harder? There's blood pressure. If you have a valve disease, we have 4 different valves in our heart. Any one of them can have failure, and that causes congestive heart failure. If you have thyroid and kidney diseases, diabetes makes you prone to heart failure. Or if you have any heart defect that's present at birth, that tends to overwork your heart as well. All right. So if you have not been diagnosed with congestive heart failure, and you start having rapid weight gain, you're dizzy, you're weak, you start to have a swollen stomach, your legs get swollen, If you start to notice that when you're lying down, that you have trouble laying down with just one pillow, and you have to add pillows for you to feel better when you're laying down, that is a symptom of congestive heart failure. So if you need 3 or 4 pillows before you can be comfortable laying down, breathing, being comfortable, then you may have congestive heart failure. Chest pain, of course, the shortness of breath, the wheezing or the coughing. This usually happens when the fluid accumulates in your lungs. Okay? So this is what your doctor will be looking for to diagnose you with congestive heart failure.